Hello and welcome to Fresh Perspectives. My name is Gail, and we have a physical therapist on the program today, and in a little while we'll be showing you a few exercises that are good for your back. Her name is Heather Beaman. Thank you for coming on, Heather.
Oh, you're welcome. Thanks for having me.
You're welcome. Yeah. Now, I think the first time I met you was quite a few years ago, maybe a couple of decades ago, when you and your sister were teenagers.
Yep.
And you used to come with your mom and dad to the Vegetarian Society dinners, the monthly Vegetarian Society dinners.
Absolutely.
Yeah. Now, what were you doing between then and going to school to become a physical therapist?
Well, it's been a little bit of a long road. So right after high school, I went to college and got a degree in fine arts and became an elementary art teacher.
Oh, really?
Yeah. And so moved down to Virginia and worked there. And then after doing that for many years, I became interested in Pilates and became a Pilates instructor. And that was kind of nice because I would do classes for the teachers that I worked with down in Virginia after school, and we would go through a Pilates session, and I just got such a great response from them that they would come into the class and they would have headaches and whatever, but then after this Pilates class they would leave, they would feel relaxed and more.
And their headaches would be gone.
Their headaches would be gone, exactly. And so after teaching Pilates for a while, I really enjoyed the one-on-one interaction with people and just the responses that I got with people feeling so much better that I decided to look into physical therapy. I had a few mentors down in Virginia. I spent a lot of time observing and asking questions before I changed careers. And then I just sort of slowly started taking classes, and finally I moved back from Virginia back to the Buffalo area and went to physical therapy school. Just like that.
Just like that. Just like that.
12 years later. So.
And now there's a difference between physical therapy. My mother had a stroke a long time ago when she was still alive, the last 4 years of her life. And she had both physical therapy and occupational therapy. Would you tell the viewing audience what the difference between the two is?
Sure. So if you have a stroke, obviously there's a lot of functional deficits that you need to sort of overcome and relearn. With physical therapy, usually in that kind of setting, you're using more larger muscle groups, working on ambulation, working on reducing spasticity, things like that. And then with occupational therapy, it's a lot more fine motor skills, working on sort of more functional kinds of things like eating, dressing, those kinds of things, where physical therapists will work more on, like I said, walking, being able to sort of reach. Coordination is also a big aspect of that. Vestibular problems such as dizziness, those kinds of things.
Yeah. Well, in my mother's particular case, the physical therapist worked with her lower body, and the occupational therapist was working with the upper body.
That is a lot of times how they will break it up. It doesn't have to be that way. Physical therapists are certainly able to help work upper extremities as well as lower extremities, but a lot of times, because hands focus so much on those fine motor skills, a lot of times that's how it breaks up.
Oh, okay.
Yeah.
Okay, so what was getting an education in physical therapy like, and where did you get your education?
Oh, I went through the physical therapy program at Duville University, or Duville College rather, in Buffalo, and it's a lot of work.
I can imagine.
It was a lot of work. We really, you cover just about everything. We cover everything from reading X-rays to, like I said, nervous system. There's a great deal of anatomy that goes into it. We get into the gross lab and dissect cadavers, things like
really?
that. Yeah. I mean, it's a whole, it's a doctoring profession. So it's 3 full-time years. We also do a lot of education on working with people too, though, and being able to sort of see what people's needs are when they go home, because we work inpatient and outpatient. So learning how to transfer patients, learning how to teach them how to walk with an assistive device after a surgery, that kind of thing. We had classes in biomechanics, so thinking about the lever arms and joints and things like that. We did a lot of group projects too, being able to work with a group of people. When you're in a hospital, you certainly are working with nurses and doctors and case management, so you have to be able to sort of wear a lot of different hats and be able to work as a team.
Right.
Yeah.
Teamwork. You hear about that a lot. I worked for the Resource Center for 21 years in the group homes,
Oh, yeah, so you know
there's
all
a
about
lot
that.
of teamwork
There certainly
there's
is.
a lot of teamwork that goes on there.
Yes. You all have to kind of, keep the patient as number one, right? So
Now somebody told me that they'd heard there's a shortage of physical therapists. Does that sound right to you?
Probably in certain areas, I'm sure there are, especially in more rural areas. I think in the Buffalo, Erie area, there's 3 schools that graduate physical therapists, so I don't believe that there's a lack right there.
Not right in this area, probably.
Right, exactly,
Yeah.
or Erie County area. But in more rural areas, there certainly, is a shortage of physical therapists. I'm not sure. I can't speak about the whole country, but
No.
so.
Yeah. Okay. I just wondered.
Yeah.
Okay. My next question was about stroke victims, but I think we pretty much covered that, unless you want to mention some things that you do with them. Some of them need speech therapists, don't they? Because it affects their speech.
It's because there's speech and also swallowing. So speech therapists also work on the muscles that control swallowing and muscles, around your lips, to be able to help patients be able to eat.
And actually, let's see, it's a certain section of blood vessels and things that actually dies in the brain, isn't it? That like a blood clot will cut off the flow of blood to that part of the brain, and that's my understanding that's how physical and occupational therapy work to get to grow new vessels and things.
Well,
and get their brain to working so they can hopefully regain the use of the body parts.
So depending on which area of your brain was affected due to the occlusion of the vessels, physical therapists have kind of an idea of what deficits they'll have due to the area that was affected. rather than growing more blood vessels, they're sort of trying to strengthen those areas of the brain that were weakened, and kind of trying to get those skills back, or at least try to modify the skills so that the patient is able to function. And so you can do that in a variety of different ways. You can do that obviously through exercise, but also through using sometimes the other part of your body. Mirroring activities are often used to kind of help patients use both sides of their body, or even just sometimes when there's an overflow, if you raise one arm, then the other arm says, "Oh, we can do that together."
Oh, okay. Okay,
Yeah.
It's pretty interesting, really. Okay, so what other types of problems that people can get that could be helped with physical therapy?
So in the outpatient physical therapy setting, I see a lot of people with low back problems, and a lot of people with shoulder problems. So people who have impinged shoulders, or some tendonitis in their shoulder. Like I said, back problems. We see a lot of people who are recovering from knee replacements, hip replacements, people with ankle sprains. Recently, I've been seeing a lot of people who have pronated feet, or kind of flat feet, who are having difficulty, or have had an ankle sprain due to those sort of deformities there. But yeah, I mean, we treat every part of the body. We even treat TMJ, neck problems. People have a lot of pain or problems in their neck that will come in. So we really work through the entire body. A lot of people, especially right now with ice and bad weather, people falling on ice, they'll come in, and sometimes they'll fall on their hand, so their entire arm is kind of...
Somebody that I had on my program a few weeks back, we were talking about, her topic was ditching the midwinter blues. And the subject came up briefly about falling. And she talked a little bit about somebody that she knows who teaches people about fall prevention and she said something about putting the foot down firmly flat on the ice, if you're walking on the ice. And then I mentioned a little boy that I knew that had told us one time, if you start to go down, just slide into it. And then and then she said, that's another thing that that this person that teaches people about fall prevention is like, not just to let yourself relax if you start to fall and slide into it. She said that is true. She said, don't put your arms down to break the fall. She goes, because you'll break your wrists. That's what she said.
Cause a lot of sort of pushing up into that shoulder joint, elbow problems, that kind of stuff. I mean, anytime that you stiffen up in a car accident or stiffen up from a fall, when you get so stiff, that's when your muscles get torn, or your bones aren't moving freely, so they can fracture or whatnot.
I've always heard that if you find yourself in the process of being in an accident, to relax.
That's just really hard.
To relax, and you won't get hurt as bad. Which people have a hard time doing. In a scary situation is to relax, but just sort of let it happen, and you might be okay, or at least not as bad as if you're not relaxed.
Yeah.
Something about having the muscles relaxed.
Right, yeah, I know. It's definitely second nature to sort of tense up when you see a problem coming, but if you kind of just try your best to stay calm, then it's better results afterwards, but it's very difficult.
Right, right.
Yeah.
Okay, now you were the speaker at our December Vegetarian Vegan Society dinner, and the topic that you were speaking about was preventing back pain and or exercises that we could do if we already had back pain. Now, there's one man who comes to our dinners. In fact, he's been on this program a couple of times talking about how he's helped himself with being on a totally plant-based diet. He had both heart disease and an autoimmune disease, those two different things. Mm-hmm. And I didn't know that he had backaches and things. You know, I hadn't heard that from him, but he's been telling me since you were our speaker in December that he's been doing the exercises you showed us how to do that day. Good. And he says it works better than anything else he's tried. He says he's been to the chiropractor and this and that and the other thing. And he says it really makes a big difference.
Awesome.
Good. But he never remembers how your last name is pronounced. He keeps referring to you as Heather Beaman.
Oh no, like Bemis Point.
Heather Beaman. And
so
a couple of times I've corrected him, you know, no, it's actually Beaman, and then
it's probably not worth it.
Yeah, I know. Well, at the January dinner, I was sitting and visiting with him, and those exercises that Heather Beaman showed us how to do really helped. So at that point, I said, well, I've already corrected him a couple of times. I'm gonna let it go. You know? I remember when I worked for the Resource Center for 21 years. There was this. First, I worked in Westfield for 10 years, and then in Jamestown for 11 years. And part of my job was to take people to church on Sunday mornings.
Okay.
And I took these guys to Bethel Lutheran Church in Jamestown on 3rd Street. And there was this one man that went to that church, and he always called me Gwen.
Oh no.
Without fail. I had to give up on correcting him too. He didn't remember. It was he could only remember the name Gwen.
It seems like once a name is stuck, that's it. Done.
Once they've established that your name is something different from what it really is, that's what they're going to call you.
That's right.
Okay, so we probably might want to move along to the exercises now that you showed us how to do. Should we do the one sitting in a chair first?
Yeah.
And then we'll go lay down on the floor.
That's right. No.
Yeah, we did yoga exercises back in the fall one Saturday,
nice.
so
Good.
that was kind of fun. Okay. Should we move the chair a little bit away from
so we can
from
just
the table?
Slide
Is it okay that the ones that we're using have arms on them?
Yes.
Okay.
That's absolutely fine. So, so I sort of started top down. So we're going to start with some exercises for your cervical spine.
Okay.
So. A lot of people
Now the cervical spine is the neck.
The neck, yep,
Okay.
exactly. So a common presentation when people come in with neck problems is sort of rounded shoulders and a forward head. And that can be from a lot of things, just daily life. When we're driving, a lot of times we're like this. Texting has become a big problem. We're always looking down at our phone.
Yeah, because it's really not natural to have your head tilted down.
No, it's
so much. But people are doing it all the time.
People are doing it all the time, and it's probably not going to stop. So we need exercises to make sure that our flexors in the back of our neck are nice and strong. So my favorite one to give my patients is called a chin retraction. And so you're going to sit up as tall as you can. You're going to imagine that your chin is going along a countertop, and then we're going to do something very unattractive where we pull our chin back to give ourselves a double chin. Exactly. So some of the things that people do is they kind of open their mouth to give themselves a double chin. Like that, but that's not it.
But those of you in the viewing audience don't do that.
That's right. So you want to sit up tall, chin level, and just pull back and then release. So I don't want...
You don't push it forward. That's not part of the exercise.
No, not pushing forward. Just pull back, hold for a second or two, and then you're going to release. Push back, hold for a second or two, and release. And I like to tell my patients that I don't want them to look like a chicken. So you want to make sure that you're kind of going in a slow movement here.
So maybe they should be looking in a mirror when they're doing it?
Well, a lot of times I'll suggest that they start lying down and pressing the back of their head into a pillow.
A pillow.
Yeah.
Okay.
I like to do this one a lot of times in my car at like a stoplight or because you have the headrest behind you, you have something to press against. So that's the first exercise for that. I also like to give them some stretches. So what we're going to do is we're going to kind of grab on to the bottom of the chair, and then you're just going to gently drop your ear to
the opposite side.
Well, your ear to your shoulder.
Your ear to your shoulder.
Yep. And so that's going to elongate this side while you're holding here. And you want to kind of imagine you're in between two panes of glass here. Now, if that feels good and you're able to, you can use your hand to just give you a tiny bit of overpressure, very, very gently. Yep. And so when you're stretching, I always suggest holding stretches for 20 seconds and doing it 3 times for a total of 1 minute of stretching. The next...
Well, let's do the other side first.
Oh, yes, good idea.
We have to do the...
We want to be balanced.
Yeah, we want our body... We don't want to throw our bodies into like when you're doing a yoga exercise, like if you're twisting to one side, then you have to do the other side.
Yes. All right, so to the other side, so just dropping that ear gently down to the side. Imagine you're in between 2 panes of glass. Good, and if you want to add that little extra overpressure, gently pulling down. Good. And then you can go ahead and release after 20 seconds there. Good. So the next exercise is also another muscle in your back. It's called levator scapula. And so you're going to feel the stretch a little bit further back. So we'll start on the left side. We'll start holding on the left side, and you're going to drop your ear to your shoulder, and then you're going to rotate your nose towards your armpit. And you should feel the stretch a little bit further back. And again, if you want to add a little bit of overpressure, you're going to put your hand sort of to the crown of your head and just draw down very, very gently. And don't forget to breathe when you're exercising too. That can kind of remind your body to relax and release into the stretch. Good. So you'd hold that for 20 seconds. And we'll do the other side also. So you're going to hold, drop your ear to your shoulder, rotate your nose towards your armpit, and then you can add that overpressure. Good. And then you release. So you're feeling better already, aren't you? Mm-hmm. Yes.
Yes. Yes, of course.
Yes, of course.
If it works for that other guy, it's going to work for me.
That's right. Exactly. Exactly.
Yeah.
Sometimes you do have to give exercises a chance, and you have to continuously do them. It doesn't always help if you just do it once a week or, once a month. You have to
do it every day.
Do it every day. It's a continuous practice, just as yoga is.
Right, right.
It's something that you kind of have to keep working at, which is true about most anything, right? You have to keep practicing.
Yeah, you do.
So
you really, really do.
Yeah. All right, so moving a little bit further down, this is for the middle of your spine, your thoracic spine. So that's that section is also where all your ribs connect to, so a lot of times that can get kind of stiff. So when I treat cervical spine, I also like to add in the thoracic because they're connected, one below the other. So for the next exercise, you're going to bring your hands behind your neck, and this is a good one to do in your chair also. Again, sit up nice and tall. Oh, we might have to lean back. And then you're going to draw a line with your elbows lifting up to the ceiling and reaching up, holding there for a second or two, and then slowly coming back down. Now, if you want a bigger stretch, you can add sort of a rolled up towel behind, underneath your shoulder blades there. And then go ahead and lift up and coming back down. So you can, sometimes when you release that scapula again, your neck feels a lot better too. The next one is just a simple rotation. So feet are nice and planted, and it's actually good we have some handles here because you can use the handles to rotate through your spine and look behind your shoulders. You can use that handle for some leverage. Make sure that as you're doing this too, you're pulling your belly button in, sitting up nice and tall. Good. And then coming back to center. Then we can go to the other side. And you might find that you have more rotation one side more than the other. That's very common. And you can come back to center.
I've noticed that a lot of these exercises are really modified yoga exercises.
Oh yeah, they really go quite hand in hand. I think they had it right when they started yoga, I guess.
Yeah, that was
they knew what they were doing.
And that was thousands of years
That's
ago.
Right.
Yeah.
So, everything old is new again, I guess.
Yeah, it really is.
So those are the thoracic exercises that I like to do. Now for your lower back, a lot of times we need a lot of strengthening for our lower back. So I think these are exercises that we might need to move more onto the floor for.
Okay.
So let's sort of head over there.
Yeah.
Should we head that way?
We can't go too far.
That's right.
Yeah, because we are fastened to microphones.
That's right.
That are plugged into an electrical source.
Sure.
Maybe right about here.
Yeah, that would be fine.
Okay.
Is this okay?
I think so.
Okay.
Okay. Not so close to each other that we wind up bumping into
Oh,
each
no.
other. Okay, so we're going to lay down on the floor.
Yep, we're going to come all the way down. So the next one is I'll sit up for a second. The next one is a bridging exercise. So that's going to strengthen everything from your low back, your butt, to your hamstrings. So your feet are going to be about hip distance apart, another yoga exercise too.
Right.
Arms down and reaching towards your ankles. You're going to start by tucking your tailbone under, slowly start rolling up one vertebrae at a time, lifting your hips up. Thinking about a nice long line from your collarbone all the way to your knees, with your knees shooting past your second or third toe. I always suggest holding for a second or two and then slowly rolling down, starting from your sternum, rolling through each vertebrae as you roll yourself all the way back down. Good, so you can go ahead and do another one of those. Tucking the tailbone first, slowly start rolling up one vertebrae at a time. This is a great exercise too because it really opens up your hip flexors. As we age, sometimes we end up sort of hinging forward from our hips and walking in a flexed forward position. So this is a nice stretch for the front of your body also. And we can roll all the way back down. Good. we'll come all the way up. So the next exercise is we're going to come onto all fours. Is that okay?
Oh, okay.
So
Is this going to be the plank pose?
no, this is going to be bird dog.
Oh, bird
Is that
dog.
okay?
Okay.
All right, so you want your wrists underneath your shoulders and then your knees underneath your hips. And then you want to make sure that you're not kind of rolled up in your back and you're not sagging in your back.
Keep your back flat.
Yep, nice neutral spine there. You're going to reach your right arm out long, and then you're going to reach your left leg long behind you.
Held off the. Oh, just
Yep.
like this.
Yep.
Okay, this is called bird dog.
That's what I call it. I'm sure there's another name for it.
Well, I can see why it's called that.
Yeah. And then relax down. And then you can go to the other side. So this takes a little, challenges your balance a little bit, but this is wonderful.
But it'll make your balance better, actually.
Yes, exactly. So as you're here, you want to think about pulling your belly button into your spine, lengthening through the back of your neck, and keeping your head sort of looking at your fingertips. You don't want to extend through your neck. Keep everything nice and long. Good. And then relax down. We can do one more on each side.
Okay.
Go ahead and reach. So another thing that people tend to do here is they want to lift their leg higher so they'll open up their hip, but you want to keep everything nice and down. Just like you could put a cup of coffee on your back and it would stay.
Oh, yeah, like a table.
Yep, you got it. And then we'll do the other side. Good. And then relax down. Okay. So this is a good modification for this, is to kind of hold onto a chair and lift opposite arm, opposite leg if you're not able to get down onto the ground.
Yeah. Like, this is also kind of a yoga exercise where actually the leg isn't, the back leg is up, you know, and straight back off the floor for a yoga exercise.
When you're on all fours?
Yeah.
Oh, okay,
yeah.
gotcha.
So, but not somebody who is presently having a problem, probably.
Right, yeah.
You
If your
know.
back is already
Compromised?
yeah, you know, it's good to do this maybe on, you know, on, like I said, holding on to a chair or the wall, something that you can hold on to, especially if your balance is also very compromised. So that's one modification for that. The next one is going to be a prone press up. So this one we're going to get onto our stomachs. Are you ready for that?
Oh, well, a prone press up, like a cobra, you
Like
mean?
a cobra,
Oh, okay.
exactly.
Okay.
So, so sometimes for some people, I'm going to come onto my elbows for a second here. So for some people, just being on your stomach can be challenging, but I suggest to my patients to try to get on their stomach. Again, it stretches the front of your body, and just getting in this position can show some benefits. So from here, you're going to bring your hands right underneath your shoulders. You're going to pull your belly button in, and then you're going to slowly start pressing up through your hands. And you don't have to go all the way up. If you can go into a full cobra here, that's fine. But if you're going to go into a mini cobra, that's good too. So then you would come right back down. So we can come all the way back up, pull the belly button in. Good, lifting up, and then coming back down. Another modification is just to come here on your elbows instead of on your hands. And that can show a lot of benefits, especially if you're having a difficult time. You have some arm weakness. A lot of my patients can't do as many repetitions, not because it's hurting their back, but because their arms are weak. So this can be a good alternative to that. So there's that exercise. There's another modification for this exercise, so we're going to go ahead and stand up.
Oh, the one by the wall?
So this one is just, you're gonna do a standing extension. So we'll stand up, and if you need to hold on to something, you certainly can do that. But otherwise, you're gonna bring your hands to your hips, and then you're gonna press your hips forward and look up, and then relax back down. Good, so you'll press forward, and then come back down. For people who have disc problems, and this is a movement that relieves those symptoms, I always recommend that they do some kind of back extension activity at least 10 times every 2 hours.
Well, people really need to be bending backwards, because, especially if they have a desk job,
Yes.
because they're always leaning forward.
Exactly. So,
all day long when they're at work. So
yeah, when people are, we're in this position so often. Again, like I said, a lot of people, especially as we get older, tend to get these tight hip flexors and kind of crouch forward. You need to use your buns, stand up tall, and I know eventually it's always good if you're always going forward for something. Always, good to balance it out, right?
Right,
Go back the other way.
Do it on all the sides.
That's right. That's right. I think we had a few more. Maybe that was it. Oh, we have the last one, our planks.
Okay.
Do you want to do those standing, or shall we sit or go back down to the floor?
These are all curtains around here. I guess we will have to go down to the floor to do the plank.
Okay. So again, you can modify this exercise by going up against a wall if getting on the floor is not for you. So what you'll do is your hands are going to, again, be underneath your shoulders. You're going to start in that tabletop position. You'll stretch out your right leg so your toe is down, and then your left leg so your toe is down. So you want to think about pressing the ground away, pressing back into your heels. Again, keep that neck nice and long. Keep your gaze at your fingertips there. And then you can relax your knees back down. So another great sort of step-by-step way to get into a plank, if planking isn't for you yet, is you can bring your hands down, tuck your toes under, pull your belly button into your spine, and then just lift your knees. Hold for a second or two, keep your knees just hovering, and then relax back down. And that can be a preparatory move towards the plank. You can also come down onto your elbows to do a plank. I think that's more difficult, but people also like that.
This is what yoga teachers tell people to do, to strengthen their arms for doing the headstand.
Gotcha.
It's kind of a headstand
Sure, a
preparation.
tripod.
Yeah.
Yeah. No, that makes sense too. Like I said, I think to me this is more difficult, but to some other people it's not. So you want to make sure your hips are low. A lot of people try to cheat and bring their hips up. You gotta make sure they're nice and down.
Yeah.
Woo! All right. Again, you can do...
We're doing it on this hard floor. That kind of hurts a little bit on the elbows there.
It does. So there's that. Side planks also are very good. I recommend sort of starting at a wall for those as well. And then as you progress, you can, get down onto the floor. So the flatter you are, the more difficult it's going to be. And then the last exercise we can actually get back in our chairs is just a hamstring stretch.
Okay. Should we turn our chairs so that they're facing the camera then, or what?
Sure, that sounds good. So let's start with our right foot. So you're gonna come to the edge of your chair, reach your right foot out in front of you, nice and long. Again, sit up nice and tall. Take an inhale. Then with a flat back, you're gonna bring your sternum towards your toes. And already I start to feel a stretch up the back of my leg. I feel it a little bit in my calf and then in the back. What a lot of people tend to want to do is they want to round their spine and get further which you can get further, but you're getting less of a stretch. Your body's always going to want to take sort of the path of least resistance.
Right.
So you want to kind of make sure that you're keeping that back nice and flat, hinging forward, reaching your sternum towards your toe. Good. Again, stretching 20 seconds, holding for 3 times, so a minute total. And then the other side. So reaching out, nice flat back, reaching your sternum toward your toe. And again, you might feel different on either side. I think I stretch my right hamstring more than my left because I'm definitely feeling it more on my left.
And that's one of the things these exercises can help with, is to more equalize.
Yeah, bringing some more balance to your body.
Right.
Making sure that you're equal. Yeah.
Now, one question that I wanted to ask was, what does it do to your body if you slouch? You teach people not to slouch, and what can happen to them if they slouch? What does slouching do?
Okay, well, slouching is something everyone needs to work on.
Yeah.
we really do. So when you are slouching here, it puts a lot of pressure onto your vertebrae, and it weakens, it tells me that you're not using your abdominal core strength. Once that's weakened, you're much more likely to have more difficulties and have weaker muscles because you're not using your core in your day-to-day life to help the rest of your structures out. So that's one problem. The other problem is when you start slouching down, you automatically come into this position where your head is forward, your shoulders are rounded. And even here, we can try this together. So if you are slouching down, you can't lift your arms as high as you can biomechanically. So when you're sitting up nice and tall, then you can reach your arms up. So a lot of people who have shoulder issues, like I think I mentioned before, come in with a very slouched posture, which causes a lot of impingement here. And there's a structure in our shoulder called the bicipital groove, and that is always the place that is sore on people because that's where that impingement happens. So sit up nice and tall. For your shoulders, for your back, for your core, for your neck, everything upper extremity. So yeah.
Okay, and then, but it can compress your internal organs though too, isn't that right?
Yes, it can. So when you're here, it can compress your lungs so that you're not breathing fully. You want to always make sure that you're taking those full, nice, deep breaths, getting oxygen to all your cells, and then also your internal organs. And then also, if you think about it, as I said before, a lot of people end up in this sort of hinged position and then rounded, and then it throws your balance off. You're more likely to sort of tumble forward in that instance.
Yeah, okay.
Yeah.
Okay, let's see. Now, diet plays a role in pain prevention. Now, you gave us some handouts with the exercises on them at the December dinner. And there was a list of foods that are the most likely ones to cause inflammation.
Yeah.
I wondered if you would
Sure.
tell our viewing audience what those are.
Yeah. A lot of times we think that what we're eating doesn't affect our healing, but it's not new news that it does.
Well, you always see people bringing a box of chocolates to somebody who's in the hospital.
That is true.
And so what are you're bringing them basically something that's almost all sugar.
Right,
you know?
exactly.
And what does sugar cause?
Well, it causes that inflammation.
Yeah, right, exactly.
And inflammation is a lot of what causes the pain in your body because your structures don't have room then to move and to glide as they should because they're stiffened. So I am not a dietitian, but these foods have been known to cause inflammation. So they're sugary foods like our chocolates, dairy products, gluten, fried foods, saturated fats, trans fats, red meats, refined carbohydrates, and alcohol. So they all elevate your cortisone levels, which is an inflammatory factor. And then foods that fight inflammation are going to be your nuts and seeds, green leafy vegetables, tomatoes, garlic and onions, berries, olive oils, and fatty fish. So, and I think at our meeting, the dietitian there was saying that darker berries were better than lighter berries for fighting inflammation.
I think most berries are dark colored. Most of them, not all of them, but I think most of them are.
Yeah, I agree. But she was mentioning that the darker the berry, the better the inflammatory. But I'm sure all berries are healthy.
Who was that? I'm trying to remember who you're talking about here. What did she speak at another one of our dinners?
Yeah, she has a dietitian certificate. I'm not sure who it's through, and she seems to study. I don't know his name. The doctor.
Oh well, there's Caldwell Esselstyn, and there. Oh, you know what? No. I don't think she is a dietitian. I think that
she has a certification.
I think that she is somebody who's in the process of curing herself of. You're talking about the one at the October dinner. She was talking about Dr. Joel Fuhrman's book.
Possibly.
Eat to Live.
Okay.
Yeah, I think that's it. I think that she came on to speak because she's seen him. She had diabetes and decided to try a plant-based diet. Yeah.
Gotcha.
And she has been able to reduce her insulin a lot.
Oh, good.
Yeah.
Okay. Wow.
Yeah.
That's incredible.
Apparently, if you can follow this particular diet, as far as type 2 diabetes goes, it's totally reversible.
Oh.
With a totally plant-based diet.
Okay.
Yeah.
That makes sense. I mean, sure. Something else that is, just something that I always tell my patients is a simple walking program too can really also help your back too. It gets your blood flow going. It's very good for the intervertebral discs in your spine. We recommend doing 30 minutes of walking 3 times a week. You can always break that 30 minutes up though. You can do 10 minutes three times a day. You know, if 30 minutes is too much for you.
Or if you just don't have the time all
Or if you
one
don't have the
time.
time, exactly.
You can break it up into the periods of time. Yeah. It's when you're walking on bare ground, it's a lot different too than walking on pavement.
Yes.
Walking on pavement, after a certain amount of time, you're going to get tired. But it's been my experience that you can walk all day if you're on bare ground.
If you're bare ground. Well, I mean, I think that the bare ground has a little bit of a give to it.
Right.
Where the cement, it's sort of, I have a lot of patients who work places where
the floor is cement.
Bothers them, and it starts at their feet and then, kind of travels all the way up the chain. So just, making sure if you're in that situation, you have really good shoes, and you're sort of switching those shoes out, every couple months.
And then there's some sorts of mats that are quite thick that help a lot too.
Sure, yeah. That's if you're in a place where you're working and you can get that kind of resource, it's really beneficial, for sure, for sure.
And then drinking plenty of water probably helps if you have back pain or anything like that.
Yeah, I mean,
isn't it? Keeping hydrated.
Keeping hydrated, keeping hydrated is always good for all body systems. We're made up incredibly amount of water, but
right.
making sure that you're not dehydrated, and when you're feeling dehydrated, then the rest of your body is probably dehydrated too.
If for some reason I'm not able to get enough water to drink, then I feel tired earlier in the evening than a day that I've been able to keep drinking the water.
Keep drinking,
yep.
Yeah.
So, but and we're not talking about we're not talking about keeping hydrated with pop or anything like that.
Water.
No. Water. Herbal tea is pretty much water, except that it's made. It's a little bit, like with herbs and things.
As long as it's decaffeinated. Anything with caffeine is going to dehydrate you.
Caffeine is dehydrating. Yeah.
So like a black tea with caffeine is going to do that. But herbal teas, like a nice chamomile or a mint tea, can kind of give some spice to your water.
Yeah, it flavors it.
Yeah.
Although our personal well at our house, I'm pretty sure they hit an artesian well when that well was drilled, because we've got the best tasting.
Do you have really good tasting
water?
water?
Really good water at our
that's
house.
Nice.
Yeah. So,
I've also seen where people just like put a slice of lemon in their water, or some strawberries or something, just to give their water a little bit more pizzazz.
Right. Yeah, and it's supposed to be really good for you. Most mornings I will, unless I'm in a big hurry, because I have to get out of the house really early to go somewhere, I will take half of a lemon, and just juice it on one of those old-fashioned things, and put that in a glass, and then fill it the rest of the way up with water, and that's supposed to be really good for you.
I've heard that as well.
I was first introduced to that 3 years after I started practicing yoga. I was just practicing out of books to begin with.
Nice.
But, and then I finally had a chance to spend some time with some yoga teachers, and they introduced me to the lemon juice with water.
Yeah. It's much better to reach for something like that than your cup of coffee, in the morning, which will dehydrate you. So starting off with something that's hydrating and has some other benefits is
And then I kind of like to warn people about carbonated beverages too, because of the fact that they're made carbonated with carbon dioxide is what's used to make them that way.
That's true.
So it causes a deficiency of oxygen in a person's body. And I've also been told that a lot of carbonated beverages contain phosphoric acid, which is the active ingredient in toilet bowl cleaner.
Oh. So
don't drink carbonated beverages.
That's right.
I've also been told that the people who own those companies that make those beverages won't let their own kids drink them because they know what's in them.
Gotcha. Well, I mean, I think it's always best to sort of stay as natural as you can and, do the best you can.
Right.
And just like I just said, just stay as natural as you possibly can.
Oh yeah. As natural as best.
Yep.
Now we are down to a little over 3 minutes that we have left, and so I'd like you to fill that up with any other things that you may have wanted our viewing audience to know while you're here today.
Gotcha. Well, the one thing that I think is important to know is that you should always talk to your medical provider about starting an exercise program, and always think about your body knows you the best. So if something isn't feeling right, it's best to stop what you're doing, or get modifications, and don't be afraid to use modifications to do some of the exercises.
And take a class.
Yes,
Take a
yes,
class, because sometimes you think you're doing things correctly and
you're not.
You're not,
and you can't see yourself.
And they can come along and say, "Let me adjust you so you know what doing this exercise correctly feels like." And like yoga teachers will come and reposition you if they notice, that you're not doing it correctly.
Right.
So.
And a lot of times when they do re-correct you, if the exercise suddenly feels completely different, because you're engaging a muscle that you obviously were not engaging before. So that's really important. And then also, if you do have low back problems, don't be so worried that it'll never go away. You've got to make sure that you're being proactive, of course, in fixing those problems, but make sure that you keep moving. A lot of times whenever you have something going on with any part of your body, you kind of have to keep it moving. And if you are having back problems, you need to see your doctor if you're having fever or chills, numbness, tingling into any extremity of your body. So I think that's really important too.
Can some of these kinds of problems cause fever and chills then? That are not contagious diseases, but maybe.
I mean, possibly. If your back is hurting, and it's good to sort of, it's good to get, like I said, if you're having fever or chills or numbness or tingling, it's always good to go and get it checked out.
Right.
It could be a million different things. And many times it's something that can be fixed. Many times it's something that maybe you have some weakness somewhere. Maybe your pelvis is a little bit off, whatever. But there of course are conditions where you would want further investigation.
Yeah, sometimes with the numbness and tingling, that can have to do with a ruptured disc or something, right?
Yeah, it sure can. Your intervertebral discs can be ruptured, like you said. They can be protracted. They can be sort of, when they come out, a lot of times, they can sort of touch onto a nerve. But if you catch it early enough and you don't wait, you can usually get the discs back into place by doing stability exercises. So you have to sort of not wait and then get yourself some help.
Yeah, I just before Christmas, when I was in Wegmans one day, I ran across a friend of mine, and she said she had just come from a physical therapy session that she was getting because she had sciatica.
Okay. A lot of times, so with the sciatica, you have to be really careful to know whether that's pure sciatica, where the sciatic nerve is being pinched into a muscle, or if that is actually coming from your back. So, it's good to go and get evaluated and see if it's a true sciatica or if it's a lower back
what's
problem.
Causing it? Yeah.
Because there's so much in there that can go wrong, but as long as you go and have some support in figuring that out, it can be diminished. So you don't have to live with pain.
No.
Yeah.
Well, I hate to say it, but we've come to the end of another episode of Fresh Perspectives, and I want to thank you for coming today.
Yeah.
This was a very beneficial episode,
I'm
and I hope that people maybe look into this if they're having problems. And I hope maybe we can have you on again sometime.
Sure.
Maybe we can do an episode on Pilates.
Yeah, that would be really fun.
Yeah.
Thank you so much.
Sure. And I'll see the rest of you in the viewing audience on the next episode in a couple of weeks.